Morning everybody and welcome and thank you for being part of this. If Lisa had spoken first and I'd have come second, it might have seemed that I was trying to curry favour with my boss at HEE by saying good things about her. So I'm going to say it in her absence, in that Lisa has a huge remit at Health Education England, but she has taken a particular interest in mental health, which is very informed, and I just want to publicly say that because I don't think it's often said. But I'm here, as you're in the dark, I can't see you. But if you work with grown-ups, would you put your hand up? Okay, so quite a few, I have to assume, are either working with the bookends of elderly or children. So I'm not going to attempt to present all the PowerPoints I've got. They're there if they're of any use to you. So I'm privileged to be chair of the Children and Young People's Mental Health Coalition. And I'm going to talk about a whole systems approach, which is one of the key planks of Future in Mind, which was the government task force and initiative about how we're going to improve child mental health. And I know it's already cropped up in the discussion earlier this morning. So I have to say what we do. We work with over 140 organisations to campaign and influence policy with and on behalf of children and young people in relation to their mental health and well-being. And we're hosted by the Mental Health Foundation. We're grateful to to people who support us financially. We're not a big organisation and we're very prudent in how we spend our money. And I'm going to say what we do. I'm going to quickly look at prevalence, and I know that already came up this morning. Pressures impact, Future in Mind, whole systems, schools approaches, and what we need to do moving forward. So there we are. We're a very colourful group of people, but the key thing to bear in mind is that we are large organisations, small organisations. We come right across the professional groups, the voluntary sector, user carers, the whole panoply. So we've got together, so we spend less time arguing about who ought to be doing what, but we had to decide what needs doing and get on with it. We collate views, including young people, and we're solution and evidence-based and values-based, because if the government want things to be value for money, they'd be better to make them values-based in the first place, because that will be the thing that will deliver the gap between demand, supply, and what we can achieve in sustainability, which is why prevention is so important. So our priorities are a whole system approach in prevention, and I've learnt today by reading a strange government document that when things go out to people across the system in the NHS, that performance management is always at the top of the list. And one of the key things they see in performance management is prevention. But of course we lack money being given to prevention because it's difficult to prove an improvement that you've brought in because you're stopping something happen. And I know that that's close to Public Health England's heart. So we're looking at the role of educational settings, and we've developed the work. So at the moment we have in our head how we could have a synergy about how we could support any educational setting, and that starts in day nurseries, goes through to schools, goes to colleges and to universities, and hands the baton on in a way that a child would have a good experience of having their mental health and well-being supported. We may all do it different in those settings, but it has to make sense to somebody who's 3 who may need help early on, right through to somebody who's struggling at university. And we all know the recent launch of the UK universities because of the concern about the rising suicide rates in students. We're also very interested in variation and inequalities, but particularly about, we talk about mental health, mental illness, neurodevelopmental disorders and learning disability. So this is what you all know. We're going to have new data next year. It will be amazing if the data hasn't shown an increase in the prevalence rates. I know you discussed some data this morning from the NCB study, and you do have to be careful about cohort studies, so I'd just put that in as a health warning. What I want to point out in the next one, looking at aware of time, is to say 36% of children with a learning disability have mental health problems. We don't even know how to assess that in children with profound learning disability, and there'll be some work coming out shortly that we're doing for Comic Relief on that. 71% of children with autism have a mental health problem. I didn't bring my autism spectacles, but I just want to put a message out from Jack, who is about helping people to aspire who have autism. And what he says on a cost-benefit analysis, if we would help Jack when he was 3 So he continued to be a round peg in a square hole because that's what he wants to be, and he has that right to be. He would not have ended up with the mental health problems he did. So, and my spectacles are red, and they have a square lens and a round lens, but I've forgotten because I'm getting old. Brain injury, again, is a forgotten part of this system. We know about the pressure of the money, and I know that you've discussed how the money isn't getting through, and I'm very grateful to the following speaker that he asked for this money to be ring-fenced. And in an upside-down way, if any of you come from Wales, the Minister has sort of ring-fenced it without using that name, and that's allowed us to progress with services in Wales. We know that children are very ill. We know they get lost in transition. We know that we fit into the agenda around what we could do to help reduce obesity. We know that local governments are under pressure, but I think their chapter in this book that's in your pack is fantastic on children and young people, so thank you. Children and young people are perfectly capable from the age of 3 of saying what they want. They want easier access, they want to take control, they want to self-guide and regulate their own help, and they're very apt and online, and they know they can embrace the new technology, so we shouldn't be afraid of social media. They want teachers to know about mental health, and God love them, they want teachers not to be depressed. So it may not feel that if you're a teacher, but that's what the study I did a few years ago showed. But better transition, listening to, but not just listening to, acting and reducing stigma. Future in Mind is a blueprint. I think it's a good blueprint. It talked about the right things. And we've got the Green Paper coming this autumn, where please, will you lobby the 2 ministers and say you want to be for services for 0 to 25? I deeply believe the civil servants want that, but whether the ministers want that, I'm unsure, so please lobby. Whole systems approach is how an organisation or agency has some connection with children, work together, covers the spectrum, from prevention, specialist mental health services based on local need. So for the health profession, we have to completely consider that health is place-based health, and hospitals are places who take children on loan when it's absolutely needed that they need to be in hospital, but they should be in the community getting wraparound care. But we need to coordinate and use the framework. So shared understanding, we did a values-based approach, which we produced, Claire Tyler chaired the commission. You can read about what was important: equal partnership, empowerment, workforce, whole system, leadership, and what Yalom told us many years ago, that what children need is us to be present and faithful, and that's the most difficult thing to be when services are disconnected and when children can sometimes show their displeasure in quite an in-your-face way. So we need to work smarter with a public health approach. We need to utilise the wider workforce. Mental health and sport in schools is what we're working on, and give children the skills and assets they need to be the good parents of 2035, working productively, contributing to local communities and helping the economy post what will still be a post-Brexit era. So there's lots of work going on in education, but the key thing is that we need a leadership in this. Schools and head teachers know best what should happen in their schools, so it's not a business of us telling them what to do, and we need to listen to teachers and not just tell them. I'm looking for red lights and things, but I'm not yet seeing them. So the 3 key principles we worked with all our 140 organisations may look disgustingly simple, but landing simple things is notoriously difficult. A better balance between attainment and well-being, and I believe Ofsted are listening to that. Better training and support for staff on mental health, both in teacher training, but actually on an ongoing basis. And better support for children and young people who need it in a way that they'll find acceptable to them. That will deliver better mental health and well-being. And there's our key principles. Leadership and management is at the centre. It's for schools to decide how they want to do that, but those are the key components which you can look up, and it's part of the work we did for PHE a little while ago. But enabling the student voice, so I'm privileged at the moment to be chairing a commission in North East schools, 300 schools. It terrifies me. The other commissioners are all head teachers except 4 of us, so I worry about my skirt being too short and I'm going to get told off. But they're brilliant. They want to know what values-based is. They want to know what the evidence base is. So if somebody comes up the drive and says, we've got the cure to all your mental health problems in school, they can interrogate it. We're teaching them how to look at what they actually want, how to measure outcomes and how to reflect and see whether they've met that. I think I'm probably now out of time, so that's that. So I just really want to say thank you for listening. There's so much more to do in this field, and I've now moved to the position where there's no such thing as the art of the impossible. It's a will and determination and supporting the workforce to be healthy themselves, that together we can improve services for all children, irrespective of their position in life. And I think we just need to get on with it and get some money ring-fenced. So thank you for listening.